and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to take a look at one of Hampton's really unique educational experiences for high school kids. And this is important if you know a student who's interested, but it's also important because these kids might be your doctors, your nurses, and your healthcare workers in the future. So let's talk to some folks from Bethel High School. We have Kathleen May, welcome.
Thank you.
And you're a nurse and a teacher there.
Yes.
And Desiree Whitley, who's a junior?
Yes.
Okay, good. I'm just going to start with you because I think it's so important to think about why you chose this and what your future is. You were not zoned for Bethel, but you picked Bethel High School because?
Because of the Governor's Nurse Academy. I wanted to pursue my career in nursing. So I thought it was going to be good. And at Phoenix Middle School, I was in the STEM Academy, so I wanted to continue the path.
So you already had some STEM education. You knew you were interested in science, math,
Yes.
kind of careers, which, okay, wait, that's not real common for girls. We tend to tell girls that they can be, smart and pretty in other areas, but science and math, did you get some encouragement along the way?
Not really. I just thought about being a nurse. No one in my family has really been a nurse. I just wanted to follow the path of science.
Okay, and when you say nurse, you're talking about not an LPN or a nurse's aide.
No.
Tell us what you want to do.
I want to be a neonatal nurse practitioner, and I want to specialize in pediatrics.
That sounds great. Okay, so now Kathleen, I'm going to turn to you and we're going to talk about how Bethel has a program that teaches them and gives them real, almost career exposure.
So we have what's called the Governor's Health Science Academy, and it's 9th through 12th grade at Bethel High School. The students all have to apply for the program.
So even if you're zoned for Bethel, even if you're going to Bethel, you have to apply to be in this part of the program.
Yes, and you have to be accepted.
Aha!
So an interview is done, the principal interviews the students and makes sure that that's what they really want to do before we get started.
Do people, gosh, to be honest, I think when I entered high school, I knew what I wanted to do. I fell in love with journalism in middle school, but I think a lot of kids don't really know, but maybe they do have an inclination, like Desiree did toward sciences or toward nursing or toward caring for people. So what do they come in and learn? How is this different than just getting that science background that they could get at other schools?
What's really cool is we start them off with Introduction to Health and Medical Science class. So in that class, we teach them how to suture.
No way! You teach them how to, right there in freshman year?
Uh-huh.
Cool! So you're getting hands-on.
Yes.
Oh, wow.
We teach them how to do venipuncture. We have a simulation lab at the school where they can learn how to listen for heart sounds and lung sounds, bowel sounds, do a head-to-toe assessment on the patient in our simulation lab.
What's cool about that is I think we used to tell kids, you have to learn all of the really technical stuff and you don't get to do anything hands-on until much later. This way, if you show them up front, is it more engaging? It's not just book learning, right?
Yes, the hands-on part is the best part.
That is so cool. I had no idea you started off with that much experience as a freshman.
What's another cool feature is the students learn how to do hearing testing, vision testing, height and weight, fine and gross motor skills testing. Then we take them to the elementary and middle schools and they actually perform the health screenings to help the school nurses.
So did you do that?
Yes, I
What's
did.
it like?
I did it at Phoenix Middle School.
So you probably knew some of the kids you were testing, right? That's your middle school.
Kind of, sort of. I knew most of the teachers, but it's really fun. I didn't know coming into the program that it's going to be that much involved into it, but it's a great experience.
Really?
Yes, it pushed me ahead in a lot that I do now.
So do you come from a family where you said you were the first one to want to be a nurse, so there's no medical background in your family. Have they all gone to college? Is it,
No one has really wanted to start a career like me, so.
So you're really blazing a path.
Yes.
And is Bethel helping you with that?
Yes.
Is Miss May helping you with that?
She helped me with so much.
How does that make a difference to you in terms of wanting to stay in school, wanting to do well?
I just want to help people and see my parents happy.
That sounds great. Well, tell us some more. So introduction to medical really is that hands-on first year. Now, do people after that, some people say, yeah, maybe this wasn't for me after all?
Occasionally we get a student that does not take the second year or leaves the academy, but most of them stay in the academy.
But it makes sense if you're going to realize this isn't your career field to do it in high school, not in college or not in nursing school or not further down the path, You're
Right.
still figuring that out. It's helpful. So what else do we learn? I'm excited about this.
We learn community emergency response training. Yeah. We actually have a crisis team at the school where if something emergent happens, the students can come out and participate in helping with the crisis.
That was great.
We also teach CPR and first aid to the students. And last year was the first year we had a summer nurse aid program.
Oh, how did that work?
Basically, we picked 10 students that were interested in getting their nurse aid out of Desiree's class. She was in the 10th grade last year, so it had to be a 10th grade student. And they spent their summer at Bethel taking the nurse aid class, and then she just became certified as a nurse aide.
Holy cow! After the end of your 10th grade year, certified as a nurse aide. I mean, typically that's something that people do later. So you could get, right now, a part-time job if you wanted to, being in an institution or helping, as an aide.
Yes.
That is really, what a benefit to students to have that certification under their belt already at this young age.
Thank you.
So the kids in your program, and that's the other thing I think that's unique about it. We have a lot of these pre-college, like pre-med kind of things, but this one isn't just for doctors.
Right.
It's for anyone who wants to be from a nurse aide or a technician, like an x-ray tech or whatever, all the way up to that surgeon kind of level.
We've even had some students that wanted to be in biotechnology, and they went on to the biotechnology program over at Phoebus.
And that makes sense too. And I know when I was looking at grad schools for my kid, there's so much overlap between biology and technology and medical sciences in terms of, learning the fields, developing new drugs, developing new materials that you can make artificial limbs out of, and all that kind of stuff interrelates. And you have to know how the body works if you're going to design things that help in that way. So how many students are in the program?
The two classes that I have right now, there's 145 students in my two classes. Wow. And then if we count the 11th and 12th graders that are still finishing up, there's about 100 in each class at Bethel.
So this really is, especially if it gets very competitive, and you have an application deadline, there's a way people need to apply to be in. You want to tell us a little bit about that?
Sure. We actually came up with a really neat marketing gimmick this year.
Okay.
We have what's called a sticky cling. You put it on your phone, and if they have the QR reader,
so you have to hold your QR reader up to the TV or your monitor right now.
Higher.
Okay.
Anyway, so they would scan this with their smartphone that has the app to read it, and it will take you right to the website where they can apply for the program.
And otherwise, you can go to the school board and find Bethel and get in that way if you're old school like me.
Yeah, otherwise, yes, you can go to the website, the Bethel website, click on the link for the Health and Medical Science Academy, and there it is.
So what do people need in order to apply? Like how do you screen people? What factors do you look for?
Well, the first thing they have to do is fill out the application completely.
You're saying that's a little bit of a roadblock right there. You got to read the instructions and make it all the way through. Okay.
Because the student has to fill it out themselves. Their parents cannot fill it out for them.
Really?
Really.
Rising ninth graders, that's a hard thing.
They have to get teacher recommendations, at least 2, and they have to be good recommendations. And then they'll be called in for an interview with the principal. They have to do well with their interview.
Principal, that's a lot. Were you intimidated? Were you scared?
Not really. I just I really wanted to be in the program.
You have a lot of confidence.
Yes, thank you.
Because we want to try to pick the students that are mature and they're willing to learn and want to be focused on their future.
Right, right. So having kids who at least step forward to do all those things in order to get in, it shows you that they mean it, they really want it, and they're probably more likely to keep working and to do, because this is more work probably than
Yes.
a lot of the other kids are putting into their education at this point.
Yes, it's very time consuming.
Do you have like field trips and stuff you do on the weekends or after school?
After school, we usually stayed after to make up work, review skills, but other than that, it was just while we were in class, there was always something that we had to do. There was never a time where we weren't doing anything.
It's a little more intense.
Yes.
So you have you got graduates yet? I'm trying to think of how old the program is. This is a pretty new program and you just got the governor's designation, but Desiree's not your first class, right?
No, I'm the second class.
Okay. So do we know where these kids are going to go when they leave you?
Well, this is the first year that we've had an actual graduating class from the Governor's Health Science Academy, and they're actually going to get ropes to wear
when they graduate?
at graduation.
Uh-huh.
And where they're going to be going is mostly to college.
I was going to say they're probably all finished with their applications right now and waiting to hear.
Because most students got their certified nurse aide or they're attending New Horizons to get their EMT so that they can go into nursing school or medical school or whatever their goal was in their future.
Well, and that's the other thing I'm going to say is that, as you mentioned, they might at some point transfer to Phoebus to do more biomedical. They might go to New Horizons in the I don't know if it's in the morning at this point, but to get an EMT or even to be in that medical field track at the governor's school side. I mean, there's all these interrelationships in the programs that Hampton City School offers that you can almost tailor what you want to fit exactly your needs.
I go to New Horizons for the medical assistant, so I wanted to just continue.
So it really does link in with other programs that can help you get to the specialty you're looking for.
Yes.
All right, so what are you going to do after you graduate?
I'm going to go to college, and I plan on going to nursing school and then plan on specializing.
Nurse practitioner school is a lot. That's like bordering on doctor level.
Yes.
That's a lot of education. But you look like you're ready.
Yes.
Or you will be by the time you graduate. Okay, well, is there anything I've forgotten to ask you about this? You want to remind people that there's a deadline to apply, but if we've missed the deadline, you could still get in an application.
Right, typically the deadline is March 1st, but if they miss that, we still accept their applications. They just have to get them in completely filled out.
You say that a couple times as if it's a little stumbling block, right?
Well, not really, just the ones you've seen. You want the students to do a really good job, like it's their resume. You know.
It's impressive to have it together in the 8th grade enough to do that. So, well, this is a great program, and I hope this show lets more people know about it. Kathleen, thank you for coming by, and good luck to you. You're going to be, you know, sometime not neonatal, I probably won't be having, maybe my grandkids. You'll be taking care of my grandkids in the hospital when they're born. So, congratulations to both of you, and thank you for watching. I hope you understand both as a taxpayer the kind of programs you're supporting that are going to teach these kids how to be valuable in the workforce from the day they graduate from high school and how to be more professionals and earn extended careers. And also, if you have a student or a neighbor or a grandchild who might be interested in this program, please spread the word and let them know about it. Thanks for watching.